Just over 50% of the population in South Dakota, as we just said, has now received at least one dose of a COVID-19 vaccine.
But one advocacy group is asking about the other half. We've been looking into the data to find out who's most at risk for missing out on a vaccination.
Native Americans make up 9% of the population in South Dakota. However, according to the South Dakota Department of Health, 1.4% of Native Americans have received at least one dose of the vaccine. Unlike other states, such as Minnesota, when it comes to demographics such as age, sex, and race, South Dakota's data does not include information from Indian Health Service or the VA in that number. Kettleman Investigates requested South Dakota's data from IHS. According to IHS, 24,981 patients in the state have received at least one dose through Indian Health. But that number did not include a breakdown for race. IHS is also vaccinating non-Indians who work for or with the tribe.
So we have non-Indians that come here that, work with the tribe, teachers, whether the teachers, tax preparers, or other businesses that do a lot of work with tribal members. So come on, you need a shot.
South Dakota's data also shows a great discrepancy in the number of vaccinations in rural counties. While South Dakota counties, which are home to reservations, show some of the lowest vaccine rates due to IHS numbers not being included, other rural counties without reservation land are low in vaccinations as well. For example, out of the 1,300 people who live in Harding County, only 139 people have received a dose of the vaccine. Out of the nearly 2,500 people in McPherson County, 247 have received a vaccine.
Right now, it seems that the general narrative is that South Dakota is doing very well with their vaccination rollout. From dozens of discussions that we've had with faith leaders, community leaders, members in labor, members in the healthcare industry, there's an opposite story when it comes to vaccination equity. In fact, the rollout is not going well.
Well, in addition to rural areas where people may not have good access to the vaccine, non-English speaking immigrant workers are more likely to not get it. Coming up in tonight's investigation into the other half at 10, we look into efforts to vaccinate the Hispanic community, especially those working in rural areas. Fewer than 0.5% of Hispanics in South Dakota have received the COVID-19 vaccination. We also asked the South Dakota Department of Health about what they're doing to ensure vaccine equity across the state.